Thank you so much. This is Fox with the National Network to End Domestic Violence, and thanks everybody for joining us today. Normally, I think this would be more of a formal, we have more formal webinars, but considering that it's more of a peer-to-peer led discussion and information sharing from our partners in Pennsylvania, I think that this will be less formal than most. And I don't know if there's an ability to open up the line for discussion. Is that possible? Well, I'll check with our organizers in a sec. So anyways, I just wanted to thank you all for joining us, and I just wanted to welcome you all. As I said, I'm Debbie Fox with the National Network to End Domestic Violence, and the work that we do is a part of the Deviant Housing Technical Assistance Consortium with Collaborative Solutions, the National Alliance for Safe Housing, and the National Resource Center on Domestic Violence. I'm pleased to welcome you to our webinar today on state coalitions and continuum of care partnerships and how domestic violence state coalitions can develop well-designed housing projects through HUD Continuums of Care today on May 14, 2019. So on today's webinar, you'll be hearing from Maria Williams from the Pennsylvania Coalition Against Domestic Violence and Lee Howard from Diana T. Myers and Associates Incorporated. We will be fielding questions in the chat box during the webinar, and hopefully we can open the line during the webinar as well, and we can have some dialogue as we're discussing different items in the during the webinar. So please feel free to chat with us there, and then we'll definitely have time at the end for Q&A. So I'm just going to do a quick overview of just what the work of the state coalition, the work of the Deviant Housing Technical Assistance Consortium, and then I'll pass it along to Lee and Maria, and they can get started as they have the bulk of the presentation. So as most of you all know, we are part of a Deviant Housing Technical Assistance Consortium that's funded by 4 federal agencies, including the Family Violence Prevention and Services Program at HHS, the Office on Violence Against Women at DOJ, the Office on Victims of Crime at the Department of Justice, and the SNAP's office within HUD. And then we work closely, as I mentioned before, with 4 technical assistance providers, and now we have a new technical assistance provider, which I need to add to the list, is the National Resource Center on Sexual Violence, who are also part of our work in expanding our reach and being inclusive of the needs of sexual assault survivors and housing. And just a little bit of background about the work of NNEDV. We do a lot of work at the policy level, trying to increase housing resources and work on legislation and guidance to increase access for survivors to housing. And then in particular, we have the project that I'm on, the Collaborative Approach to Safe Housing for Survivors, that organizes webinars and trainings like this that help disseminate information into the field at the intersection of domestic violence and homelessness. And then I also work closely with our Safety Net project, address the intersection of technology and safety, and so a lot of the work intersects with that we do with the CoC project, with the Safety Net project, as a big piece of HUD funding and federal funding is data, and Maria and Lee will be talking about that more. So we want to make sure that we're collecting data in a way that is survivor-centered and confidential and does not disclose the safety of survivors in order to access housing resources. So I'm going to go ahead and pass it along to Maria. She can get started and do an intro. Lee and Maria can do their intros, and then go ahead and get the webinar started.
Great, thanks, Debbie. This is Maria Williams, and I'm the housing specialist at the Pennsylvania Coalition Against Domestic Violence. And PCADV is the domestic violence-specific state coalition here in Pennsylvania. We have a separate coalition regarding sexual assault, but all of the state programs that serve, or all the local programs that serve survivors statewide are members of PCADV, and so that's how we intersect with our membership. Lee, do you want to introduce yourself?
Sure. Hi, good afternoon. I'm Lee Howard, president of Diana T. Myers and Associates. We are a housing and homelessness consulting firm in Pennsylvania. We work with 9 continuums of care across the country on their organization and technical aspects related to applying for HUD funding and implementing that funding, with the majority of our work being done in the state of Pennsylvania.
Thanks. So today we're going to talk a little bit about the DV bonus, what happened in FY18 with the DV bonus and what's coming up for this year. Give you a little bit of an overview of the basics of that and the program types that are funded. We're then going to talk about the role of a statewide coalition and how the statewide coalitions can intersect with the continuums of care and housing funding opportunities to best serve survivors across the state, and how member programs of coalitions can really be supported by that work. We're going to talk about what continuums of care need from state coalitions and from member programs to effectively fund DV housing. And then Lee and I are going to talk a little bit about what we've done in collaboration in Pennsylvania regarding funding applications and systems integration, and then what we have coming up in the future, just to give you an example of what could work. But the important part is that you know that every relationship that you have in your own community is going to need to be tailored and specific to the needs of your community, and this is just one example of how we've made things work here in Pennsylvania. So we'll start with the DV bonus specifically, and Lee's going to talk about what a continuum of care is.
Great. So the Continuum of Care is a program of HUD which provides communities with homeless assistance funding. This CoC program is authorized under the Homeless Emergency Assistance and Rapid Transition to Housing Act, which was passed in 2009. And the CoC program requires that communities establish a local continuum of care and process to apply for CoC funding from HUD. As the slide states, the CoC should be designed to promote a community-wide commitment to the goal of ending homelessness, provide funding to support homeless assistance, promote access to and effect utilization of mainstream programs, and then optimize self-sufficiency among households experiencing homelessness.
So the opportunities for collaboration between the state and state coalitions and the CoC are going to be different in every state, and even within each state and each CoC that'll be different. And there's some very specific ways that state coalitions can partner with the CoC or encourage member programs to partner that are listed here. But the thing to keep in mind is that we know that one of the biggest barriers to safety is housing. And so one of the most essential ways to create safe housing options is to partner with the CoC. And you can do that most easily, I think, by building a relationship with CoC leadership. Or if you have a member program that's very engaged with their CoC, leaning on them to help guide the way to then translate that to work with other member programs. So each CoC really has different access points, and I think that it's important for both DV coalitions and for member programs to figure out who in CoC leadership is really going to be a champion of domestic violence work and a champion of serving survivors and making sure that that's part of the strategy to end homelessness within the CoC.
So I just want to point out, this slide says 2019 NOFA and priorities. It's May 14th. The NOFA has yet to be released. So I just want to make that known that the priorities here that are presented are the priorities that were included in the 2018 NOFA. HUD has indicated that their policy priorities will remain consistent for 2019, but for any of you who are involved in the NOFA-related work, I just didn't want you to see this slide and think, what did I miss? So the NOFA, in case you're not familiar, is the Notice of Funding Availability, which HUD puts out annually, and it is the application or the competition by which HUD sort of facilitates a process to award homeless assistance funding to continuums of care across the country. There are four, as I stated, four HUD policy priorities that are described in the NOFA. I'm just going to talk very briefly about each. Ending homelessness, really what HUD is talking about is looking at the needs and the size of the population for each type of population, so whether that's single individuals, families, youth, et cetera, as well as subpopulations, which would include veterans, survivors of domestic violence, et cetera. In terms of that policy priority, it should also include a comprehensive outreach strategy to ensure that the CoC is in fact identifying all persons experiencing homelessness and really using data to identify which households most need assistance, meaning households with the longest length of time homeless, households with significant service support needs, and as well as using data to identify the needs or the gaps of the CoC. Secondly, creating a systemic response to homelessness. CoCs are expected to use the coordinated entry system to provide assistance to households experiencing homelessness quickly. HUD is also expecting continuums of care to use their system performance measures, which we'll talk a little bit about on the next slide, but the data related to those system performance measures to reduce the length of time specifically and reduce returns to homelessness. The third policy priority, strategically allocating and using resources, really is HUD looking to ensure that continuums of care establish a process, a transparent process, a data-driven, performance-driven process to evaluate project performance and maximize CoC resources to make sure that the investment that's being made in different projects to serve different populations and subpopulations is really responsive to the community needs that have been identified, and that those projects really are working to increase end homelessness for the households being served and also to increase the system performance overall. And lastly, using a housing first approach. Hopefully, housing first is a concept that you are familiar with or at least have heard before, but it really includes the rapid placement of individuals experiencing homelessness into housing without preconditions. So there's no requirement to accept services. There's no requirement, for example, to have a protection from abuse order if someone is a survivor. It's a process by which barriers to entry are removed before entering housing. Next slide, please. So quickly, we're not going to, oops, back one, I think. There we go. We're not going to talk in much detail about the CoC system performance measures, but if you're not familiar, I think it is helpful to know what those are because HUD, as I mentioned, this is a competition. The higher the score of the continuum of care through the CoC application, through the NOFA process, the more money typically is awarded to that community. So it is a competition. The system performance measures are something that continuums of care are required to report on, and they're heavily scored within the CoC application and competition. So those include the number of people experiencing homelessness. This would include folks who are counted in the PIC count, the annual point-in-time count, which includes folks in emergency shelters, which would include domestic violence shelters. It includes transitional housing programs. It includes safe haven programs. and it includes anyone identified as unsheltered, meaning sleeping in a location like a car, abandoned building, on the street, in the woods, depending on your community, but somebody who is in a location not safe for human habitation. The number of persons who become homeless for the first time, this is a systems level sort of measurement, not an individual project measurement, but that's one of the things that HUD is looking at to see how effectively communities are able to prevent and divert folks from entering homelessness to begin with. Third, the length of time persons remain homeless. Again, this would include folks who are in emergency shelter, transitional housing, or unsheltered, and really looking at all of those days collectively drive the system's average length of time, median length of time that folks experience homelessness. Returns to homelessness, this would be once a household is placed into permanent housing, they're returning to homelessness within a 6-month, 12-month, and 24-month or 2-year window of time is what this measurement looks at. Next, looking at the successful placement or retention of permanent housing. So those are two different ideas that are sort of mushed into one system performance measure. They're measured different ways for different project types. So, for example, successful placement in permanent housing, rapid rehousing, for example, is measured that way. Retention of permanent housing is the measure by which permanent supportive housing projects are measured. And then lastly, employment and income growth for persons and CoC-funded projects. I just want to point out that this is the only measure that indicates in CoC-funded projects the employment and income growth measure is in fact limited to just folks served in those CoC-funded projects, whereas each of the other system performance measures are measured across the CoC system regardless of project type, regardless of funding source. Next slide.
I think that one of the things that's really important to remember too in looking at HUD's policy priorities and then the system performance measures is that the DV movement has really looked at emergency shelter and safe homes and transitional housing as a means to safety for survivors. And that is absolutely true. But the thing that I think as DV providers that we need to remember is that once a person enters emergency shelter or a safe house or they enter transitional housing, they're homeless. So we know that survivors are far more likely to be safe and stay safe if they have their own housing. Emergency shelter is certainly an excellent and very much needed intervention for some folks, but it's not the need for all folks. And so when we're looking at the policy priorities and system performance measures, I think that they can often seem like things that seem far from what we in the DV field really incorporate into our daily work that's so focused on safety and autonomy. But really, if we take those and can translate them into the survivors that we work with every day, we know that we don't want survivors to become homeless because they're far more likely to be unsafe and become homeless again. We know that we want less people in emergency shelter because if there are less people, that means that folks are able to find safe housing options that are longer term for them and these sorts of things. So it's important to be sure to correlate the two. I think too that, and I'm just briefly reading this question in the chat box, but it is absolutely true that if a survivor has come into shelter and then they end up returning to shelter, that in the DV work that is considered a positive thing. And this is part of the reason that building a relationship with the folks that are in leadership in your CoC is so essential, because things like that are absolutely true. And the more that as DV providers we can learn to talk about how safety issues are paramount and that a return to shelter can actually be a positive outcome for a survivor, and really learn how to tell that story well and show data that then says, and then after that person exited shelter, they exited to safe housing. Those are the sorts of things that can really bring DV work into homelessness work and really help the two run parallel to each other. And we can get into more of that later.
Yeah,
so,
can I jump in too for just a moment?
Yeah.
And as Maria said, we are going to talk about this more in one of the upcoming slides. But I do want to acknowledge that the data that's used to measure, to report out the system performance measures is directly pulled from HMIS, which means that DV data is not included. I would argue that HUD definitely understands that returning to shelter is not a negative thing, obviously, if safety is an issue. And one of the other things, I'll talk more about this at the appropriate time, but Maria's absolutely spot on with really working with your continuum of care to ensure that at the local level, the data that's being used to evaluate project performance is also reflective of that.
Thank you. So the considerations that the folks working directly with HUD in the DV field have really come to, like our partners at NNEDV and NASH, have really worked effectively and successfully to help one system inform the other. And where we're really seeing that come across is that the comparable database to make sure that we're collecting data that is confidential and de-identified, and then report on the aggregate level rather than reporting on the individual level. We also have pushed for the idea that fast access to permanent housing can impact outcomes, and that survivors are more safe and stable when they have safe and permanent housing. It also, the expansion of DV housing funding has really allowed the DV movement to look at options other than transitional housing. And while we know, without question, that transitional housing is an excellent option for some survivors, it's important that it not be the only option that is something other than emergency shelter. And so adding rapid rehousing and permanent supportive housing and prevention and diversion measures really creates a robust system that's in line with Housing First philosophy to allow survivors to have options to choose from, rather than just saying, you know, even to access services, you have to become homeless. I believe that our movement has come a long way from that point, but I do know that you know, we have been so rooted in the emergency shelter idea that it's often hard to break away from that. So HUD has been very responsive in the development of housing interventions that will benefit survivors, and we'll talk more about the specific interventions later. One of the most important ideas to come about too is that the Category 4 definition of homelessness from the HEARTH Act allows survivors to not have to become literally homeless before they can qualify for or be eligible for rapid rehousing, for example. And that's when housing interventions are funded through the continuum of care, a survivor can still be living with an abusive partner, but know that they need safe housing and can access safe housing through eligibility in Category 4. And then also, you know, the HUD requires CoC to use a coordinated entry process, and the idea that there is one access point to all of the housing interventions within a continuum of care really is built to assure that the folks that need those housing options the most are the ones that are getting them first. And what we know is that survivors are often going to be the folks that are going to need those housing options first. And so the more we can partner with our coordinated entry programs within the CoC, the better, and the more that those can be survivor informed, the better, and there's HUD recommendation regarding that. And there's been a lot of work done on the national level regarding recommendations. On the Safe Housing Partnerships website, there's a great article, or a number of great articles at this point, about best practices for survivors in coordinated entry. And so if you're interested as a state coalition in engaging in coordinated entry, you can certainly reach out to any of us on this webinar, but also the Safe Housing Partnerships website has great resources regarding that.
Great. So I'm going to talk a little bit about the DV bonus. Again, this is based on the 2018 NOFA. What we do know is that 2018 HUD allocated $50 million for the DV bonus to specifically provide homeless assistance for survivors. We know that in 2019, another $50 million has been allocated for that purpose. What we also know is that over $60 million was awarded to support assistance for survivors through the 2018 CoC competition. That included not only the $50 million through the DV bonus, but also additional funding that was awarded to DV projects that were ranked in a position that was then funded by HUD. The ranking could be its own webinar, so I'm not going to go too far down that path, but if you're not familiar with the CoC local competitions in your community, what I can tell you is that all projects that are being submitted for funding are in fact ranked in order, and HUD has a predetermined funding line by which everything above that funding line is considered quote-unquote safe. And will likely be funded unless there's something sort of structurally wrong with the project that's requesting something that's ineligible. Everything below that funding line, which last year was 93% of already awarded funding was considered safe. 7% of current funding was part of a competition along with a bonus opportunity. The funding there was, it's called Tier 1 versus Tier 2. So if you are not familiar with that, I would encourage you to read the NOFA once it's released to better understand, and as well as talk to the folks in your continuum of care. One thing I want to just point out for those of you who do have projects that were selected and funded through the 2018 NOFA, those projects should have been included on your CoC's grant inventory worksheet and are eligible for renewal. I know that that was a question that some folks had. They weren't sure that the projects, because they have not yet begun, would be renewed this year. Yes, you should be renewing them in order to ensure continual funding once the project is started. The other thing I will just point out is that any projects that are in fact up for renewal, those will not be funded through the $50 million set aside. That is for new projects, the $50 million. The renewal projects that were initially awarded through the 2018 competition will be added to the CoC's annual renewal demand, which is the total value or cost of renewing all existing projects. So that will be a separate pot of money that those projects are renewed from. Next slide, please. So we're going to talk a little bit about each project type, but this is just sort of a very brief overview of the DV bonus. As I indicated, FY 2019 competition will include another $50 million for new projects specifically. Continuums of care may create up to one of each of the following project types. So permanent housing, there's two types. There's a short to medium term permanent housing program, rapid rehousing, which we're going to talk about in an upcoming slide. Permanent supportive housing, which is not eligible under the DV bonus, and so that point is made, and we're going to still talk about it, define it, because I do know that some survivors do need this additional supportive housing, which extends beyond rapid rehousing. Next, the Joint Transitional Housing Rapid Rehousing Component Project. This is a relatively new project type for HUD. I think this will be the third year that this will be an eligible project type, which really sort of blends and combines transitional housing and rapid rehousing. If you have programs, for example, that are transitional, and one of the barriers that you have in your community is once safety is no longer an issue, identifying resources to assist survivors into moving into permanent housing, this may be a project type that you would want to consider. Next, coordinated entry projects, which are supportive services only. Maria talked a little bit about coordinated entry. We're going to talk about it a little bit more on one of the upcoming slides. But if there is a need for enhancements to your existing coordinated entry system to better serve survivors, again, this may be a project type that you would want to consider. And then finally, HMIS and comparable databases. This, like permanent supportive housing, is listed because it is a project type that communities will be able to apply for. This is not eligible under the DV bonus. The only projects that can apply for an HMIS grant is the HMIS lead agency. So just to summarize that, the projects that are available for the DV bonus are the rapid rehousing, the joint transitional rapid rehousing component, and then coordinated entry projects.
Part of the reason that we wanted to go into those details a bit is that the important piece of it is that the CoC can create only one of each of the following project types. And so this is where having a coalition apply for those funds on behalf of member programs can be really beneficial. You're not having then member programs compete against each other for that funding. You're coming in with a collaborative application and showing the need on a broader level, and that your member programs in the CoC are willing to work together to help solve homelessness for survivors within the CoC, rather than running a bunch of individual programs. So a collective application can really be beneficial, and it can put a coalition in a really great spot to support member programs. And when we talk about what we're doing in Pennsylvania, we can talk about that a little bit. So the framework for all of the HUD-funded housing interventions is housing first. And like Lee was saying, that means that we are helping folks to get into housing with very low or no barriers to that housing. And we've seen this in the movement over and over again, that survivors are actively kept out of housing because of their survivor status. And so Housing First really works to benefit survivors. So our friends at the Washington State Coalition Against Domestic Violence really spearheaded the work around domestic violence Housing First. And what they have determined that to mean is that you get survivors into stable housing as quickly as possible, and that's what really allows them to rebuild their lives. And there are pillars that DV Housing First relies on, and that's survivor-driven, trauma-informed advocacy, flexible financial assistance, housing stability, and community engagement. And it's very similar to what the rest of the world considers as Housing First also, but it really tailors it to the needs of survivors and making sure that survivors have options. And that there's a variety of things that survivors can choose from if they're in need of leaving their home or they need support to stay in their own home, letting them define what safety means. And this has worked really well because we know that there's never enough shelter space, particularly in urban areas. You know, a lot of times you can get 30 calls for shelter and only one family is going to be brought into shelter. So there has to be other options that survivors can choose from. And also a few years ago, transitional housing was deprioritized by HUD and has been deprioritized by most CoCs, and what that means is that transitional housing isn't going to continue to be funded in the way that it used to. And we'll talk about the transitional to rapid rehousing joint component. That's a great answer to that. But because of the deprioritization of transitional housing, it means that the DV community really needed to come up with a variety of other responses to homelessness experienced by survivors. And then we also know that once a family or individual is homeless, they're far more likely to become homeless again. And so if we have a variety of responses set up in the system to really address that issue of homelessness or housing instability, we know that survivors are going to be safer in the long run. So the intervention that is really sort of the most prevalent right now with HUD is called rapid rehousing, and I'm sure that the majority of you are familiar with it. But this is significant funding, and it's really important that all of us in the DV movement figure out how rapid rehousing can be best used for survivors, because this is going to be something that continues. And I know that I've worked in communities and helped communities move through the idea of using rapid rehousing for survivors, and oftentimes what it feels like is rapid rehousing is something that's being put on us rather than something that can actually benefit survivors. And so again, from the National Alliance for Safe Housing, Chris Bilhart has written an excellent article about how rapid rehousing can be adapted for survivors and tailored specifically to survivors' needs. On the whole, the idea of rapid rehousing is that households are going to live as independently as possible, that they would rent an apartment just like I rent an apartment, and they would have that rent amount subsidized and the amount that the survivors identifying they need subsidized, and there's also income restrictions based on that. Assistance can go up to 24 months, but again, what's really important is that you provide an individualized service for each survivor you're working with in rapid rehousing. One of the easiest ways to spend a whole lot of money is bring in very few families to a program and say everybody's rental assistance is going to last 24 months. What we know is that we need to serve the maximum amount of survivors we can with the money that we're allotted, and make sure that the survivors that are in services are really getting the things that they need. And so that individualized tailored work is really, really important. And knowing that you could subsidize someone's rent for up to 24 months, but we don't want anyone to be dependent on rental subsidy for that long if they don't need it. And so, you know, if that time can be shorter, that's fantastic. And if it can't, and you find out that it can't, looking then for longer-term housing support is probably where that family or individual would be best supported. So those modifications is really to rapid rehousing are really important, and knowing that this is a great intervention that can be used to really support survivors and their safety, rather than knowing that it's time limited and can be rigid. Really working with your CoC to help understand how the flexibility within rapid rehousing and HUD's intention for flexibility within rapid rehousing is what serves survivors best.
Great. As Maria just stated, some households will need assistance that goes beyond 24 months. And for those households, permanent supportive housing may be a more appropriate long-term option. Permanent supportive housing is really permanent housing with non-time limited housing supports. So that includes either leasing or rental assistance, as well as supportive services designed to ensure housing stability of that individual or family. In order to be eligible for permanent supportive housing, someone in the household must have a disability that's typically the head of the household, or a child. And just like rapid rehousing, the idea is that the supports will be sort of customized and tailored to each household based on their needs. Permanent supportive housing can be either site-based, in a building, or scattered throughout the community in apartments like Maria described, rapid rehousing. Couple things I just want to let folks know about permanent supportive housing. I think that there has been some misinformation in the past about the documentation requirements associated with being eligible for permanent supportive housing, and whether somebody who is Category 4, a survivor, whether or not they do qualify. They do, in fact, qualify for permanent supportive housing. The other point I just want to make is we recently got some questions related to documenting survivors as being chronically homeless. So if that's not a term that you're familiar with, what I can tell you is that chronically homeless, to be eligible as a household that's chronically homeless, it's the head of household that has to have the disability. A child cannot qualify a household as chronic under that definition. It also includes that over the course of 3 years that there's at least a 12-month period of homelessness. That could be a 12-month continuous period of homelessness or multiple episodes over the course of 3 years that total 12 months of homelessness. So households that meet that chronic, it's more complicated than that nutshell version, but households that are defined as chronically homeless are prioritized, I would assume, in every continuum of care across the country. And so understanding that definition of chronic homelessness, understanding how to assist in terms of the documentation to ensure that a household is eligible for permanent supportive housing, and if needed, it can be documented as chronically homeless, will be really important. One of the things that we recently did was to submit a question to HUD asking for more details and clarification around the documentation requirements for folks who are in Category 4 and how they would qualify as chronically homeless. Once we receive that information, I'd be happy to share that with Debbie and get that sent out to everybody who's interested. In terms of the application to DV, really very similar to what Maria just presented on rapid rehousing. The other piece that I'll just add is the last bullet there, partnership with community organizations that have experience with PSH are important. DV organizations really can look at rapid rehousing as an opportunity to apply if there is a significant need in the community, or to really serve as a partner to an organization that has experience and understanding of permanent supportive housing, and as a partner look to provide services for survivors. Next slide. Yep.
So the next funded housing program is the joint THR RH component, and that is a mouthful. So you'll hear this called the joint component. You'll hear it called THR RH. You hear it called a variety of things, but it's all this. So the HUD has really heard that and agrees that transitional housing can be a great option for survivors. And we know in the movement that survivors that are dealing with addiction or long-term incarceration or long-term homelessness or a whole variety of other things like mental health concerns can really benefit from time where they are in a transitional housing program that is non-time limited to some extent and flexible, and they're not having to worry about rent, and they're really able to get back on their feet in a way that they're identifying that they feel can help them move forward. So within that, though, it's important that there be a permanent housing option that's attached to it. And so that's what the joint component is. It's transitional housing with rapid rehousing attached. It's an incredibly flexible model. Again, it can be provided for up to 24 months. But providers want to be really cautious about how that 24 months goes. Because not every household is going to benefit from transitional housing. One of the things that I know I've fallen into as a former provider is looking at somebody that's having a really hard time finding a unit and is having a really hard time signing a lease, maybe because of past evictions or a poor rental history, and thinking that transitional housing is the option for them, when truthfully, when a survivor can be in permanent housing and a DV provider can really do whatever it takes to help that survivor get into permanent housing, if that's help pay down debt or pay a double deposit for a landlord or work in other ways to negotiate for that survivor to get into permanent housing, they're going to benefit more from that. So I want to caution you to use the transitional housing component with great intention, and to not make sure, as I have in the past, to use it for folks that it seems like they don't have any other options, so this is just what we're going to do. Really think about what the needs are in your community for survivors that would benefit from transitional housing, and use it for those survivors. So it really does need to be survivor-driven, not based on provider belief, and again, as brief of an intervention as possible, but really tailored to what each household needs.
So another project type that can be funded through the DV bonus is the Coordinated Entry SSO, which Supportive Services Only grant. The coordinated entry can be used for system improvement, for staffing, et cetera, based on whatever the needs are related to the coordinated entry system in your community. As the slide says, really look to your community, compile information about needs, assess really how the funding can be best utilized. And I can't emphasize, enough about how really community-driven this application or consideration of this application should be, really based on an understanding of how your communities or your COCs coordinated entry system actually works and how to best expand the system or assist the system to serve survivors. I think the most important thing that you want to try to make sure is happening is that survivors have equal access to housing resources, and really this is the key. So communities, organizations that receive Continuum of Care dollars as well as Emergency Solutions Grant dollars, they use the coordinated entry system to identify and enroll folks into those projects. So if a survivor is not on the coordinated entry, whatever it's called in your community, the queue or the prioritization list or whatever it is, they're likely not going to receive homeless assistance through Continuum of Care or ESG funding. So I emphasize that again just to say looking at this intervention to determine how to best adapt the system or incorporate DV is imperative. As the slide says, be creative and lean on best practices. Maria's mentioned a couple times that the Safe Housing Partnership website has a number of resources that can assist with this process, and it's an excellent opportunity for coalitions who are already engaged in housing work or have yet to be engaged. I know that there was a question that was typed into the chat box related to this, and I'm going to defer my answer just towards the end because I think the answer is a bit larger than where I want to sort of pause here. But great question, and if others have coordinated entry or other questions, please also type them into the chat box. The last thing I'll just quickly mention is that there's a document on the HUD Exchange website, and I'll pop the link into the chat box in just a moment, that's called the Coordinated Entry and Victim Service Providers Frequently Asked Questions. And looking at the existing documents, whether it be on the HUD website or the Safe Housing Partnership website, or even talking to other DV coalitions across the country through this type of peer opportunity, I really think can help to illuminate some of the The requirements, if you're not familiar with the coordinated entry requirements from HUD, but also possible solutions that communities have identified based on the barriers that they have run into in terms of ensuring equal access to resources among DV providers, or excuse me, among survivors.
Okay, we're going to move into talking a little bit more specifically about state coalition and CoC collaboration. Really, there are three main ways that we see that working, at least. And again, like in your state and your CoC and the CoCs that your state coalition would work with, it will be different. But here in Pennsylvania, at least, and I think that a lot of this is translatable, we've found that funding, systems improvement, and data are really the three places where state coalitions and CoCs can connect and really support each other mutually. So as we were saying before, through the DV bonus, you can only submit one project of each type. And so what PCADV decided to do was come in as the applicant for the East CoC, which was one of the balance of state CoCs here in Pennsylvania, because we didn't want member programs to have to compete against each other, and more importantly, the member programs identified that that's what they wanted PCADV to do. So it was a really great mutual relationship there. And it can put the burden then of the administrative end of the application and then the funding moving forward on the coalition, assuming that the coalition has more capacity to handle that administrative task than our individual member programs do or than culturally specific programs do. It's a really great way for our coalition to sort of provide foundation for member programs to do the work that they need to do. And that's been really beneficial. Coalitions can also apply for coordinated entry funding. It's a great way, like Lee was saying, to move into the housing realm because we know that survivors aren't going to get CoC resources unless they are on the coordinated entry list. And so having a DV expert that can interact with the coordinated entry system can be hugely helpful. Or if there are other ways that funding could support the system that would make it more friendly to survivors, then those are the sort of things that you want to get funded. And also regarding Housing First work, I know when I started here in Pennsylvania, it was, brought to my attention that really what we needed to do here in Pennsylvania is roll out the DV Housing First framework and make sure that programs are working through that model. And that is fantastic, and it makes services easier, and we serve more people, and it's really great work to do. But it makes it all more compelling, I think, to member programs if they also know that they're going to get rapid rehousing money and administrative funds to really be able to actualize Housing First work and move them into that space. So it's a good relationship to build. There's a lot that CoCs can then partner with coalitions to get in return. There's clarification and support regarding coordinated entry, and if you are struggling with coordinated entry in your area, really relying on the state coalition to come in and offer training, because that's one of the things that HUD recommends, can be really important. And then also Housing First, DV Housing First work really brings the work that we would do with housing in alignment with CoC and HUD priorities. As far as systems improvement goes, one of the things that the member programs in Pennsylvania stated clearly is they needed someone to, at the coalition level, to really guide the housing work in the state. And that there are upwards of 60 member programs, and that there needed to be someone that was making sure that everyone was talking to each other, and that the DV system was communicating with the housing system. And so I was lucky enough to be able to do that work. And I think that it's really changed the nature of the coalition and how we're viewed by both our housing partners and by our member programs when the leadership here at PCADV has decided to prioritize the thing that member programs are saying that they need. So that has been important. Systems improvement with coordinated entry, again, can go both ways. The CoC can really make sure that survivors are being served well, and when they do that, they know that then everyone else is also being served well. There are leadership opportunities with the CoC. CoCs have boards and other committees, and encouraging member programs to engage in their CoC in that manner is going to inform the whole system. And I know that member programs in Pennsylvania who have folks on CoC boards say that it really makes the entire system more trauma-informed because they're at the table. And I think that that's incredibly compelling and also really supportive to our mainstream housing partners that are doing the work. And then cross-training and making sure that mainstream housing providers know how to serve survivors well, and making sure that survivors, or that organizations that primarily serve survivors and our member programs have the capacity to interact with mainstream housing providers and understand that system better, and that leaning on each other for cross-training has been essential. And the last piece of this is data, and it's probably the most complicated piece, and it certainly is the piece when I think Lee and I really cemented our relationship, because if you're going to have disagreements over something with your CoC, it's going to be data. And so if you can get through that, you can really get through anything, because that will be important when you're working on a collaborative application. So it is really difficult oftentimes for mainstream housing, folks in the mainstream housing world, to understand what the restrictions are regarding DV data and why. And there's often an idea that, like, we're just keeping things from people and that we don't want to share, when truthfully I think that there's been a sort of a lack of information in how DV providers can share data and how we can share it well and intentionally. And so that's the thing that we're working to move toward, and really the only way that you can do that well is understanding what both systems need. This level of housing engagement also really encourages our member programs to get creative about how they're tracking data. Most of our comparable databases don't track returns to housing because it's not something that we would typically think of. And so how can you, or returns to homelessness, excuse me, and so how can you track that, and how can you be creative with that and still secure with that and still give aggregate data and that sort of thing, but have real numbers that talk about your shelter turnaway rate, and talk about the fact that on the whole, this percentage of survivors return to emergency shelter once per year, or once every 2 years, or whatever that number may be for your community. And then talk about the unmet need, I think, too, is really essential and important. And so figuring out unique ways to do that will help really bring your data to life and really tell that story. All of the HUD-funded housing measures are data-driven, and so knowing that that's the space in which we need to compete, I think, creates a compelling argument for making sure that our data can accurately tell the story of survivors that we're serving. So
I just want to clarify, I think when we did the introductions, I didn't really say much about what my role was in this, other than the fact that where I work. But our role, our firm usually works under contract with the CoC's collaborative applicant that submits the actual application to HUD for funding. In Pennsylvania, for the balance of state CoCs, which is what we're talking about today, our firm writes the application to HUD, and so my job is really to maximize our points and therefore maximize our dollars. So I say all that to say that for everything that Maria just said on these last 3 slides, in terms of funding, systems improvement, and data, really emphasize why she is my favorite person, because she really understands how the state coalition and member programs can really work collaboratively with the CoC in these really, really important ways. So one of the things, as Maria just indicated, all of these things will sort of help assist your community in looking at the DV bonus for 2019. It's not on the slide, but for those of you who don't know, I just wanted to also explain the scoring of the DV bonus because it sort of has its own scoring system. Again, I'm not going to go into too much detail, but just a quick overview. It's scored on a 100-point scale. 50 points of those 100 are based on the CoC's application score. So the CoC application is worth 200 points. So it's basically whatever the percentage is of those points. If you got 80% of those 200 points, you would get 40 out of 50 points for your DV score. The other 50 points is driven based on the type of project you're applying for. If it's rapid rehousing or the joint component, 25 points is awarded, up to 25 points, I should say, based on the stated need for the project and the data provided to demonstrate the need. And then the other 25 points is related to the quality of the project applicant. For coordinated entry, the points remain the 50 points for the CoC score, but the other 50 points are based on the need for the project. So I wanted just to explain that before we got into the key components within the slide. The reasons why these are important for so many things is to really ensure that I think what can be helpful around these questions is, does the DV member organization or the state coalition really understand how the coordinated entry system, how the CoC operates, and does the CoC and coordinated entry system understand how to best serve survivors within the system? I think really diving into these questions can help to identify where there is perhaps some educational gaps or some lack of knowledge about some of the nitty-gritty details about how folks are served and how folks are served in an equitable way. So I'm just going to sort of walk through question by question just to make sure that you guys have a decent understanding about what is needed for the CoC application. These questions were directly pulled from the 2018 CoC application, so of course they could be different in 2019, but I would expect a lot of similarities. So first question to be reviewed, addressing the safety needs of domestic violence, dating violence, sexual assault, and stalking survivors, applicants must describe the CoC's protocols, including the existence of the CoC's emergency transfer plan, and then secondly, how the CoC maximizes client choice for housing and services while ensuring safety and confidentiality. So I think if you are not already engaged in some of these conversations around the CoC's protocol, specifically the emergency transfer plan, specifically what happens when a survivor calls coordinated entry or walks into a coordinated entry site, specifically around are there designated numbers or sites for survivors, et cetera. There's so many different ways that the CoC could enhance and should customize the system to meet the needs of survivors. The second piece is really one of the points that I made before, is really ensuring that the CoC has the ability to prioritize survivors within the overall system, and to do that in a way that is ensuring the safety and confidentiality of survivors. And so what I mean by that is here in Pennsylvania, we have some rapid rehousing projects that are currently operating, that are being operated by DV organizations. If those DV organizations within our CoC were the only resources that were dedicated to survivors, and survivors were waiting for an open unit within those programs, I can't imagine how detrimental that would be to survivors in need of permanent housing. Instead, what really needs to be happening is that you may have dedicated programs that are operated by DV organizations, but survivors need access to all resources, regardless of type, regardless of who's operating them. And you as DV coalitions need to have faith and understanding and the knowledge that these survivors can be served in a safe and confidential manner. And when that doesn't exist, I think this is a great opportunity for the coalition to engage with the CoC to better understand how to make adjustments within the program in order to ensure the safety and confidentiality of survivors. Next, applicants must describe how the CoC coordinates with victim service providers to provide annual training to CoC area projects and coordinated entry staff that addresses best practices in serving survivors. This is something that is expected of each CoC every year to have at a minimum a training to talk about the best practices for serving survivors. If that's not currently happening, I would encourage you to engage the continuums of care to offer to provide that training. If it is happening and it's happening like somebody like me instead of somebody like you, I would even more perhaps strongly encourage you to reach out to assist with that training. And what I mean by that is it doesn't matter how much I know about domestic violence. I know I don't know nearly enough to be the voice or the expert on that. And I think that's really what you all can do and ways that you can partner with and assist the CoC by presenting that information to homeless assistance programs. Next, applicants must describe the data the CoC uses to assess the scope of community needs related to domestic violence, including data from a comparable database. So I'm going to fight the urge here to jump up on a soapbox because I know that it's complicated. But this is, as Maria said, this was sort of what really cemented our relationship was the data that was needed for the purposes of the 2018 CoC application. Many, depending on the CoC and the size of the CoC that you are working with, you may have many different DV organizations within that CoC. If you're working, as Maria's at a state level, there's going to be a considerable amount of data coming in from different sources or different organizations, and is there a way to actually summarize that data without going piece by piece through paper? I think these are the kinds of questions that I would really encourage you to start thinking about now, and we're going to go into more detail about what kind of data is really needed. But for folks like me who are under the gun to try to submit the CoC application, who don't have access to data, I really would encourage you for all CoCs across the country to really start looking at this now and to consider ways that, again, that as a partner to the CoC that you can really be helpful. It will, in fact, strengthen the CoC's ability to successfully be awarded a DV bonus project. More specifically, if applying for DV bonus, these are the kinds of things that that HUD is looking for. How many survivors the CoC is currently serving within the CoC's geographic area, so it could be a single county. Again, it could be the majority of a state, depending on the size of your continuum of care. Secondly, the data source used for calculations. And third, how the CoC collected the data. These are all things that the CoC will have to respond to. Next slide, please. Just continuing here, how many survivors need housing or services in the CoC's geographic area? Without the data coming from you all, I can tell you that what we have access to are very little things. We have access to the number of people in DV projects during the January point-in-time count. Most communities do ask about history of domestic violence, actually HUD has changed the question over the last couple years to ask not just history, but is your homelessness being caused from a domestic violence type of situation? So within that, we have, again, data at a point in time The other data that we have is who on the coordinated entry systems queue or waiting list or prioritization list has a history of domestic violence or who was fleeing at the time that they reached out for coordinated entry services. This tells us very little and really does not indicate adequately the need for housing or services, and through partnership with between the continuum of care and state coalitions, I think we can really better get a grasp on what the needs are. The data source used for that calculation and then how the data was collected is again requested there. Moving on to 1C-4D, we also need to describe the unmet need for housing, specifically related to the project type being requested. You may need to educate your CoC about how the coordinated entry system is inadequate to address the needs of DV survivors. Again, this goes back to LaToya's question, which we're going to circle back to here in just a few minutes. Quantify the unmet need, describe the data source the CoC used, and again, how the methodology for determining the unmet need. Again, if applicants are applying, there also is a question that is stemmed in how these projects are going to be responsive to that unmet need. If your data is showing, that you need more shelter and you're applying for rapid rehousing, you need to talk through how you expect to use the rapid rehousing assistance to reduce or increase access to shelter. So regardless of what your needs are, regardless of what your data is showing, I think there are ways to absolutely use any of these project types to really respond to those unmet needs in your community. Next slide, please.
I already turned it.
Oh, sorry. Thank you. Applicants must describe the capacity of each project applicant applying for DV bonus. So this is the source of 25 points, as I mentioned earlier, within the 100. So looking at the rate of housing placement of survivors, the rate of housing retention of survivors, improvements in safety of survivors, and how the project applicant addresses multiple barriers faced by survivors. I think of those, number 4 is the one that we found that folks could easily answer, perhaps number 3 and number 4. But what seemed to be consistent in terms of what we saw across the continuums of care across the country that we work with is that very few member organizations or coalitions are capturing data related to the rate of housing placement of survivors. Some do because they operate, for example, a rapid rehousing program. Some do not because they operate shelter, and when someone leaves, they may or may not know the exit destination of that survivor. What is even less known, as Maria already indicated, is the rate of housing retention. Because of the way the data is tracked, I think that's very difficult to understand using just data. And so I think, having conversations around what member programs can do to individually, as an organization, track housing retention is going to be something that's really, really important moving forward. So my question, or my comment, I guess, is, again, really starting those conversations now. We don't have an OFA yet. These questions could change, but I think we should expect to see very similar questions, and really positioning yourself to be to provide the assistance to the continuum of care to compete for these resources really benefits everyone. The last question that is, I think, something that coalitions can be helpful around is addressing racial disparities in homelessness. This was the first year that this question was included in the CoC application. Basically, the CoC assessed whether or not there were racial disparities in the provision of assistance or the outcome of homeless assistance. So for example, do you have more folks in your community who are experiencing homelessness, more people of color, for example, than exists within the larger community? I was looking at some data just the other day. It said 22% of a community's population was African American, and 46% of their folks experiencing homelessness were African American. That would definitely be a racial disparity. Another thing that communities are looking at is within the folks who are receiving permanent housing or a particular type of service, are there racial disparities there? If 46% of the folks within your homeless system are African American, are 46% of folks also receiving permanent housing resources or more? And if not, again, that could be another example of racial disparities. So is this work being done by your coalition? Many CoCs are really just starting to look at these issues. I think in many cases, state coalitions have been looking at racial disparities for a lot longer. Is this work already being done, and how can you bring the work that your coalition is doing to the CoC to inform or expand the way that they're looking at these issues and really help to coordinate those efforts? I really think in many cases the DV system is far ahead of the homeless system and looking at these issues and really could help to be a leader in this area. Next slide.
Okay, so now we're going to talk a little bit about what we have been doing in Pennsylvania, but I think we should do it real fastly.
Okay, so this is a snapshot of Pennsylvania. The blue counties there that you can see are the 14 entitlement continuums of care, which means they individually, as a county, apply to HUD for funding. Everything on the left side of the map, which is yellow, is considered to be the Western Pennsylvania Continuum of Care. Pennsylvania is unique in that we have 2 balance of state CoCs, whereas most states have 1 single balance of state CoC. We don't have time for me to explain the history, but it's weird, I'll tell you that. So the 20 counties are in the west and 33 counties are in the east, and that together the east and west establish our balance of state.
So within that, PCADV serves the entire state, and we have 59 member programs. In talking about building relationships between state coalition and the CoC, what we've done is PCADV prioritized housing, so it made it easier for member programs to communicate with the CoC and for the CoC to communicate with member programs.
Active involvement by member programs in the CoC. Maria's already mentioned a couple times that member programs have been involved really in the continuums of care since the beginning. That includes receiving CoC funding for transitional housing and now rapid rehousing, as well as the joint component. DV organizations serve on the governing board in the western part of the state. A DV provider designed the coordinated entry system in order to ensure equal access for survivors. There has been just a long-standing tradition of having active involvement by member programs within the work of the CoC. In terms of building relationships around the DV bonus, as Maria already indicated, PCADV partnered with both the East and West Continuums of Care to identify member organizations and who were partners then to PCADV within the application, but because the DV bonus only permits you to submit 1 project application per type, PCADV served as the applicant for those projects with the intention of providing rapid rehousing assistance throughout the entire geographic area.
We found that was a great way to support our member programs, and then also in the other CoCs across the state, I've gone to member organizations, member programs, and helped them do a little bit of an assessment about what is working for them, what's not, and where they really need funding to do more work. And then they've taken that information to their CoC in preparation for the DV bonus. So you can either, as a state coalition, you can either help folks get ready for the DV bonus application, or you can help them by providing the administrative support for the application. And then the other place where the state coalition and the CoCs really intersect is regarding coordinated entry. And we've talked about that, but specifically, I serve on the coordinated entry committees for both the balance of state CoCs, and I've done consultation with coordinated entry systems across the state. I think that what I have found, and I know it's not this way everywhere, but what I have found is that if the CoC leadership has someone that they can go to that isn't a provider who is completely overwhelmed with the day-to-day work, because that's how things go in our world. They have someone that they can go to and say, what do we need to do about this? Who can you put us in touch with? It really, it makes things run so much more smoothly, and it really gives a person for that relationship to sort of rest with, rather than that also being the burden of member programs. So again, I would really encourage all the state coalitions to look at how they're prioritizing housing, and if adding staffing to their team to support the housing work would be a good solution. Many other state coalitions across the U.S. are finding that that is helping.
Other ways that we have collaborated and will continue to do so include policy development. Maria already mentioned that she serves on the Coordinated Entry Committee in both the East and West, which has been really instrumental in ensuring that the policies and procedures and the operation of the coordinated entry systems in both of those CoCs really that take survivors' needs into account. In addition to that, Maria serves on the CoC's Written Standards Committee, which again, we're establishing the written standards for providing assistance, which includes the length of time assistance is provided, the amount of assistance that can be provided, et cetera, and really ensuring that those are created through a DV lens. I think one of the first major policy development things that we worked on was the VAWA Emergency Transfer Plan. Before Maria came to Pennsylvania, our CoCs sort of hastily adopted the HUD template as our emergency transfer plan, only to then sort of sit down and review that with Maria and realize it was really inadequate to implement in a way that was survivor friendly within the context of our CoCs. So we've really overhauled those emergency transfer plans in order to ensure that they could be implemented in a way that reflects the operation of our CoC and to the ease of survivors. It really takes a lot of the burden off of providing documentation and things like that off of the survivors.
And then as we've talked about, training and technical assistance going both directions can be hugely helpful. Lee and myself and one of our state funding partners have developed a training around eligibility for each of these housing interventions. And it's been fantastic to present that training because then we know this DV community is being represented and that survivors' needs are being addressed. And the more that we can show up as state coalitions and allow that to happen at all levels, I think is where we can really create then capacity for member programs to do the work, the everyday work they need to do if we're handling sort of these larger systems issues. We've also done trainings regarding how to best serve survivors and general homeless programs. We've done joint training regarding coordinated entry. We're going to do training regarding emergency transfer policies in Category 4. I've supported the point-in-time count and gave a bit of training on webinars to make sure that folks knew how to work with survivors during the point-in-time count. And then the more that DV programs and the state coalition can show up and present and partner with folks to be at state-level housing conferences and gatherings and workshops, the better. So if your member programs can't be there, then knowing that you can be there to represent what the member programs are saying they need, that tends to really inform the system well. One of the things that came out of that was development of CoC-specific DV work groups, which are made up of member programs who are wanting to push forward the idea of DV housing first and making sure that survivors are represented at all levels. And so what the coalition has done has been a convener, essentially, to allow member programs to come together to talk about housing and talk about how they would like to inform the system.
I think the last point we just want to make, and we're running out of time, so I apologize for that, is diversion. So this is a priority to develop really a robust diversion initiative as part of really helping to prevent folks from having to come into the homeless system. And that work is really going to require sort of hand-in-glove collaboration between the CoC and DV to ensure that we are, in fact, encouraging diversion through a DV lens that does, in fact, ensure the safety and confidentiality of survivors also coming to the continuum of care for homeless assistance. So that's in the very beginning stages. Perhaps we can talk about that at some other time, but I think the inclusion of Maria at the table and having DV member programs at the table for those conversations is going to be vital to its success.
Thank you so much, Maria and Lee, for all of your wisdom and expertise and just providing us a wealth of information in a pretty short window of time. And I think for many folks and other sister coalitions that we're working with and we're doing the peer-to-peer support networking with, I think this is just the beginning of conversations, and I feel really fortunate that you all volunteered your time to present to other coalitions that are thinking about or maybe have applied for the bonus funding or HUD funding in prior years, and just helping people think through different ways of what it could look like and how to shift funding or what's possible with all these new resources. And I think we have a few minutes. I know that you guys did a lot of answering of questions during the webinar, but if anybody else has questions that you want to chime in, we have a few more minutes. And then just a reminder, I know Lee mentioned this, but we're ahead of the curve, which is quite nice. Like the NOFA has not been released yet. They said sometime in May. HUD has informed us that it should be coming out anytime soon. So it's really great that you have this information and to know that there might be changes or it might be like slight shifts, and it's important to be connected with your CoC to have those discussions and to look through the NOFA so you're up to date on what the priorities are for the coming year. But as Lee mentioned, there's a new amount of the $50 million funding, so a new pot of money that folks can apply for. And then for those that received the first chunk of change last year, you will be able to apply as a renewal. So this is a really exciting time that we're going to have up over $100 million out in the field rolling out, and I think it's going to make a real big shift in policy priorities and increasing access for survivors who are experiencing homelessness. So it's a really, really wonderful time in terms of DV and homelessness and housing interventions and the work that we're doing with HUD at the Housing Consortium. So we have a couple minutes, and I want to make sure we have time to answer LaToya's question.
Yeah, I'm not sure if LaToya's still on the line, and Maria, if you can jump on if you have anything that you want to add, but I think it's a great question, and I'm not surprised. I mean, I think no matter, every CoC is different, as we've stated multiple times. So I think that there probably are examples where the CoC wants to be friends with the DV providers and the DV providers aren't interested, and times where the DV providers are knocking on the door of the CoC and they're not going to answer. So unfortunately, that does happen. A couple thoughts that I had sort of immediately are really what struck me about the question was that the CoC board determines the priorities and what's needed by the local plan to end homelessness, which does not include DV. So I think that what I would encourage LaToya to do and anybody in this kind of situation would be to look at the U.S. Interagency Council on Homelessness, the benchmarks and criteria around ending family homelessness. Given the correlation of domestic violence and homelessness, it would be hard to imagine that any community could really make consistent strides forward to address family homelessness if they are not taking a hard look at domestic violence. And so I think providing some education, if they don't already know and understand the correlation or the overlap between these two populations, really helping to expand their understanding around that. Another comment that I had was HUD is expecting CoCs to annually evaluate their coordinated entry system, and they're starting to actually talk in more detail about what that evaluation should include. It should include focus groups with providers, with individuals who've been served by the system, et cetera. And so I think somehow really pushing for and encouraging an evaluation of the system and ensuring that the needs of DV are really incorporated into that evaluation process would really be very beneficial. And the last thing I'll mention is really, one of the ways that we've been able to really prioritize DV consistently. DV is a population that's prioritized within both our East and West strategic plans to end homelessness. And one of the ways that has occurred, and this has really been an ongoing focus of our CoCs, is that we have DV member organizations that are in leadership positions. They're on the board, they're on committees, they're really helping to drive this process in our communities. And I think there's such value in that. What I would say also is, I don't know why anybody would, but if I can be of assistance and help to talk to your CoC about why I think it's important and why I think they should think it's important to be taking a hard look at DV and including the needs of survivors into their priorities, I would be more than happy to do that as well.
Well, we're officially over time, and I think that we'll take you up on your offer, Lee. And as you can see, everybody, our contact information for Maria and for Lee is on the last page there on that slide, and you're welcome to reach out to them as you're going through this process. And then also we have a call coming up in the next couple of weeks, so hopefully that'll be timed well for the coalitions, timed well for when the NOFA comes up, so we can continue the discussion and hear more about what people are doing in other states. And I think with that, I think we're wrapping up. And I just really want to thank Maria and Lee again for taking their time to share their expertise with all of us today. And I'd like to thank everybody for joining us on this webinar. You have the PowerPoint currently. You can click on it and download it on the slide deck. But also I'll be emailing it out along with the recording from today. So you'll be able to access this information down the road and send it to your colleague as well. So thank you all for participating and have a great day.